right. So we have now a very nice transition to go from what's happening with digital health technology adoption in different parts of the world, urban, suburban, rural, different parts of those communities, to now a major thread of research within HITLAB around age tech. And some of our partners from the World Bank and some of the folks that they're working with are here to talk about what is being adopted and what's being utilized with this digital health reset on the age tech front. And by the way, go to hitlab.org. We do have a new challenge with AARP in the age tech technology, digital technology challenge. So please, if you have any kind of an age tech platform and you want to enter for all kinds of amazing prizes, check out hitlab.org and apply for those through the AARP Age Tech Challenge. And now up we have our colleagues from the World Bank to talk a little bit about what they are doing in age tech. Please welcome the World Bank.
Hi, good afternoon. Can you hear me well? Yes. Let me check the clicker and see my presentation. First, my name is Xiaohui Hou. I'm a senior economist in the Health, Nutrition, and Population Global Practice in World Bank. So now we're shifting our lens to the older adults and looking at the longevity economy, not just in the States, but also across the globe. Oh, great. So first, I want to show a couple of the stats. Okay. Many of you have already know the pace of the population aging is much faster than in the past. And in 2020, the number of the population aged 60 and over actually outnumbered the population 5 and under. The UN estimated between 2015 to 2050, the proportion of the world's population aged 60 and over is almost doubled, and from 12% to 22%. And in 2050, 80% of the older population is going to live in low and middle income countries. So that is a large untapped market. I'll quickly go through some charts. This is a distribution of the older population across the world. And although now it's the dark blue are the where the more older people, but the countries now in the light yellow color or light blue color are going to catching up very quickly. Looking at the disease burden, there are lots of speakers have talked about this morning as well in terms of the chronic illness, namely, for example, the cardiovascular disease account for 30% of the total disease burden. When we're looking at the data in terms of the older population living home alone comparing to younger population, we find actually more older population living alone, which requires a lot of the assistive technology to enable them to live by themselves safely. So, overall, the United Nations also called the investing in healthy aging. They declared from 2020 to 2030 as healthy aging a decade. So that is related to the UN SDG, Sustainable Development Goal, as well as universal health coverage for all the population. So, not just the bank, but also other UN sister organizations are also working on that. So part of our work, we developed a FAIR framework looking at the primary health centered care, where the primary health care is in the center, and we hope the service delivery model can be more integrated with the long-term care, secondary and the tertiary care, and the community care. I don't know whether, you know, yeah, the centered care. This care model has to be based on the demand side preference, based on the national policy, national strategy, as well as country-owned demographic, age and gender, and also their culture. Because in some societies, home care is certainly much more preferred comparing to institutional care. And mainly on the supply side, we're looking at the finance, innovation, regulation, and evaluation, the FIRM framework. So those are the main levers that we are working with the developing nations to strengthening their care for the older population. Under the innovation, we're looking at the innovations in different organizational forms, but also quite importantly, the digital health innovation. So as a couple of the speakers have mentioned this morning, so we're delivering care in a digital world because the rapid advance of digital health technology and the virtual technology, and also the great awareness and demand for person-centered healthcare, which we listened this morning as well from Amy West. So there are a huge trend in terms of customized healthcare to accommodate a personal preference. So this is just not in OECD countries, but also in many low and middle income countries that we are trying to emphasize. So for the digital health technology, we broadly categorize it into 3 categories. We tend to do more of, frameworks or categorizations. So one is the clinical applications, which assist diagnosis and treatment using digital technology. And the second is more in terms of the data, information integration, and data case management. The third category is convenience application, which focused on the customers in terms of the virtual coaches, application using nudges, etc. And for the older population, we use the terminology called assistive technology, which basically assists older adults to have a more safety living in home or in institutions. Of course, there are lots of the barriers for the older population to use digital technology. One is affordability, whether the users want to pay for it. And also quite importantly is whether the payers, either through health insurance company or third-party payers or public finance, would be willing to pay for the digital health technology. So that is the area that we are also working with the government in terms of financing and the payment and the benefit package. The second is the ease and use of the support. The data actually shows in the States and more severe in developing nations, the older populations, their utilization and the knowledge acquisition of the using digital technology is fairly limited. Of course, there are like other, barriers as well. However, independent of all those barriers, the market data has shown there is a huge increase and a potential in terms of assistive technology in the States and also, for example, in China as well. As the aging, we know that in Latin America and the East European countries, there is also a huge demand. So now I'm inviting my colleagues, Kyoko Tokuda, to introduce the HTAC in Japan.
Thank you very much. Let me quickly introduce some HTAC being implemented in long-term care facilities in Japan. Clinical applications on your left. This remote monitoring system detects the elderly's irregular move on their bed and notify caregivers to prevent injuries. This system can also analyze the elderly's behavior patterns, which allows caregivers to avoid unnecessary visit during their sleep and then ensure the elderly's quality sleep. According to a survey, 60% of caregivers felt the reduction in their mental and physical stress by installing the system. From the return on investment perspective, this system is expected to cut off numbers of the caregivers during the nighttime. Next in the middle, information to integration. This system can import behavioral patterns analysis sensed by the sensors and integrates health data with care records. Such real-time information technology and information sharing enables caregivers provide a tailored care and reduce staff meeting and reporting time. Moving on to the right, consumer application can maintain autonomy and dignity of the elderly people, which is very often neglected, but very important. A university startup, HOW, developed an AI-embedded wearable cyborg to empower both caregivers and care receivers. This device can detect faint signals of wearer's intention from the surface of their skin and strengthen independence of the elderly people. Lastly, a prestigious bed manufacturer, Permanent Bed, and a robot company jointly developed a smart bed. This bed has an odor detection system, which enables caregivers to provide timely care to the elderly people, which actually help elderly people's dignity as well. Behind the scenes is this cross-ministry collaboration and multi-sectoral partnership. In Japan, the Ministry of Health and Ministry of Economy jointly assisted the development of age tech to fill the gap between the supply and demands in advanced silver economy. We can apply this FIRE framework to analyze what's to be considered to advance age tech. I'll stop here and hand back to Xiaohui.
Thank you, Kyoko. And for this framework, we are not only just apply it to Japan, but also to a number of the countries across the world, including Mongolia, UAE, Bangladesh, etc. So just a couple of more examples. For example, like in Singapore, in the community, in the elder care center, in the room, they have different sensors, so which can detect a person's fall or movement. And also in Singapore, the facility also collecting the information, so they can analyze it to be better predict in terms of the accidents or incidents. Kyoko already described some age tech in Japan, so I'll skip it. And in Russia, they started telemedicine in 2020. But more importantly, is that in Russia, they asked the health insurance agencies to include telemedicine as part of the benefit package. So that become mandatory for a number of the states. Once there is a financing and an incentive that provides a more enabling environment for the adoption of the digital technology. And in the States, we already heard a lot in terms of the using virtual reality for dementia and also for other disease. In Taiwan as well, it's more integrated data system. So the patients and the different types of the providers, they can look at the patient information more simultaneously, so they can make a more comprehensive, they can make the clinical decisions based on more comprehensive information. So overall, when we're working with the developing nations, we use this framework, which was published in the Lancet in terms of adoption of the digital technology and looking at the population, trying to really understand the preference of the population. And the bank and other agencies working with the government in terms of the governance structure, in terms of the regulation and also data security. Financing and the incentives, we are looking at the benefit package, trying to see that whether we can prioritize interventions, including digital health interventions, to be included in the in the benefit, also looking at the unit of the cost and the effectiveness, and the training of the workforce, and help them to establishing platforms and tools for quality assurance. So overall, in order to transform, the transforming to enable the development and the uptake of the digital health technology, we see that in terms of the bank and other agencies at the macro level, we are working with the government to provide more enabling ecosystem. At micro level, as we have a lot more tech companies and investors here, I think you know more about the technology innovation, but also on the societal level, we think that building digital skills of the patients, healthcare workers, and building a more enabling ecosystems are quite important. So that's, I think, what HITLAB do is to bring every sectors together in order to have a more transformation impact. Thank you so much for your attention, and I think my time is up. If you have any questions, feel free to stand by.
So there you have it. It's again, just another piece of evidence about what digital is doing around the world now in a different population, age tech, and understanding the importance to recognize, first of all, the need, and then number two, to make sure that we're aware of, from an empathy standpoint, how people that are in the age tech category are adopting their technology and ensuring that we're designing, again, patient centricity and UX, UI factors being front of center, making sure that we're designing technologies and platforms that fit their socio-technical needs and their socio-technical abilities.